Hello there. Today we'll be talking about prostate enlargement. What is the meaning of a prostate enlargement? Welcome to your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Olaide Jinodu. If you're not yet subscribed to this channel, I know you are missing out. Why don't you subscribe right now and hit that notification bell so you get notifications every time I post new videos. Now, straight to the chase. Men have the prostate gland, so women don't have prostate gland. Now, the prostate gland is just underneath the bladder, above the penis. Once a man reaches the age of 40 and above, the prostate starts to enlarge. Many a times, this enlargement is not even noticed by the man. It enlarges and the man might not even have any issues with it. But now, what we're talking about today, the scope of today's topic are the different kinds of prostate enlargement. Now, there are three major types. I'll start from the least serious to the most serious, starting with prostatitis. Now, prostatitis is an inflammation or swelling of the prostate gland due to an infection, most likely a urinary tract infection. So this can just be treated by using the appropriate antibiotics. The next one is called BPH, benign prostatic hyperplasia, or just benign prostatic enlargement. The word benign means it is not cancerous. Benign prostatic hyperplasia can be treated either surgically or medically, depending on how large the prostate is. Now, the very third one is the most severe, and call it CAP, cancer of the prostate. And the major treatment of cancer of the prostate is to surgically remove the prostate glands and both testicles. I know that sounds kind of grotesque. Now that we've mentioned these three types and their possible treatments, let's go into the signs and symptoms. Now, signs and symptoms might overlap. Since we know the location anatomically just below the bladder, when a man starts to feel urgency, meaning that urge for you to want to urinate, and rushes to the toilet and tries to urinate, and you're noticing poor urinary streaming, instead of expecting the urine to come out like a tap, it's coming out in trickles, worsened by pressure. You're pressurizing it, trying to come out. The moment you notice that it's not coming out, you're thinking of a prostate enlargement. Then when you leave the bathroom, urine that you are trying to force out is not coming out, then you are thinking of a prostate enlargement. Those are likely symptoms. Dribbling, urgency. At times, you might see blood in the urine. Other symptoms might be pain. Now, depending on if it is prostatitis, benign prostatic hyperplasia, and CAP, you have overlapping symptoms. They will all have symptoms of bladder outlet obstruction, meaning obstruction, urgency, poor urinary streaming, and all that. Then you can have your urine splitting into two. Those are signs of a prostatic enlargement. By the time you start having weight loss, chronic weight loss, you're thinking of most likely a cancer of the prostate. How do we make a diagnosis? There's something called a PSA. A PSA means a prostatic specific antigen. The normal value should be between 0 to 4 nanograms. If you have anything between 4 and 10 nanograms, you're thinking of a BPH, a benign prostatic hyperplasia. But anything above 10, you're suspicious of a cancer. Now, we want to go the extra mile. We want to find out if this is actually a benign prostatic hyperplasia or we're dealing with cancer of the prostate. We take a biopsy, a sample from the prostate gland. This is done by your doctor. Take a sample and send it for cytology and histology to check the cells under the microscope. It takes about 2 weeks to 3 weeks for the result to come out. Once the result comes out, it lets you know if we're dealing with a prostatic cancer or a benign non-cancerous prostate. Now that our diagnosis has been made, the line of treatment, if it's prostatitis, we do an MCS, urine MCS, just to find out the exact antibiotic that will be sensitive to it. If it's a benign prostatic hyperplasia, your urologist will prescribe the best route. If we have a prostate cancer here, depending on the state of the patient, the age of the patient. Some people are already so elderly. Imagine a man of 80, 90. There's no sense operating on such a man is most likely going to die on the table. You want to give some other injections or drugs. There are things that your doctor could place you on. But if the person is much younger, you can remove the prostate gland and put testicles. If you remove the prostate gland and leave the testicles, you have not done anything, because the testicles produce testosterone, which fuel the cancer. Prevention. How is it prevented? Well, it can't really be prevented, right? There's a genetic undertone. So if your dad or your uncle has a prostate enlargement, you most likely will have. Don't forget that every man above the age of 40 will have some form of prostatic enlargement. Not every prostatic enlargement will lead to BPH or cancer of the prostate. For you to have BPH or prostatic cancer, you want to think of the genetic predisposition or the genetic susceptibility to this disease. The only way it can be prevented is for you to have a regular PSA done, or a regular rectal examination by your doctor. You see your doctor once a year for this purpose. It's better to be safe than sorry. You can prevent it that way. But there's no other way of preventing it outright. That okay, take this drug, take that drug to stop prostate cancer. There's no such thing as at the time this video was made. And another disclaimer: if you know this patient has prostate cancer or any form of cancer, please ensure that they don't take folic acid or anything containing folates. Dark green leaves contain folates. So ewedu, bitter leaf, ugu, stop there. Now, what is the prognosis? The prognosis depends, just like any cancer, depends on the stage at which this cancer is caused. If you're dealing with a prostatitis, that's just an inflammation due to an infection, the prognosis is very fantastic. Ensure you just get the appropriate antibiotic and you're good. If it is BPH, meet a urologist. Your urologist will let you know the best procedure for you, because every procedure has its complication. For the prostatic cancer, it depends on the stage at which it is discovered. If it's discovered early enough, the prognosis is very rewarding. But if it is discovered late, very poor prognosis, if you know what I mean. If you just love this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.